We all know that we're in the middle of a climate emergency, and it's really important that our speciality recognises this and contributes to progress forward. Climate change is going to be critically important both for our patients who are facing the consequences and for our health systems, because we need to get resilience to the problems it's going to generate. I'm really proud that RCEM has been leading the way on this through its environmental group, and in particular the GreenED project, which gives departments an opportunity to practice what we preach and make a positive contribution to the sustainability agenda. It also means that we can do positive things in our departments even when we're facing a tough time with such issues as crowding and workforce. So thank you to everyone who's been involved in this. It's been a tremendous piece of work, and good luck for Emergency Medicine Day.
A couple of years ago, the World Health Organization stated that climate change is the single biggest health threat facing humanity. The IPCC report went on to state that we have a rapidly closing window of opportunity to secure a livable future for us all. As the planet continues to warm, we're having more and more extreme weather events, from floods, and droughts and hurricanes and so on. And the effects of these are most commonly seen in emergency departments around the world, from trauma and increased transmissible disease to people who've been forced to leave their homes after an extreme weather event or due to food insecurity from a prolonged drought. That is why the Royal College of Emergency Medicine released the GreenED campaign to provide emergency physicians around the world with the tools they need to minimise the environmental impact of our day-to-day clinical care. However, it is also why I believe that each and every one of us as healthcare professionals has a moral and professional duty to do our part for the environment, from making sure we use a green bank to eating far less meat and dairy. It's important we all do our part, not just for the planet, but for our patients too.
Planetary health and human health go hand in hand. And as the climate crisis continues, the effects of extreme weather events are going to be seen in emergency departments, both in terms of human health and patient presentations, but also the resilience of existing services such as IT systems which can cope with extreme heat. The Royal College of Emergency Medicine GreenED initiative focuses on helping your ED reduce its carbon emissions, and in doing so improves patient safety and staff well-being, helps to build a resilient department, and will save you money. Together, our incremental gains can cause positive systemic change for a livable future.
So why GreenED? Well, I think for me, the most important driver has been trying to reduce the amount of plastic waste we're producing in our emergency department every single day. One of the most satisfying things about joining has been watching green projects become successful despite all the other challenges we're facing in the emergency department at the moment. We know that simple interventions such as reducing cannulation are great for patient care, but they're also great for staff well-being because they save staff time. Each department will save on average around 15 tonnes of CO2 equivalents per year. That's a lot of carbon, but there's also a cost saving of around £40,000 per department per year. I think one of the most valuable things about joining has been the monthly catch-ups with the other GreenED sites, where we've been able to share ideas and also troubleshoot existing ideas. We're accredited by RCEM and we're also aligned with the NHS Net Zero targets. So join us today, get involved with our projects and come and help do your bit to save the planet.